Healthcare is changing, and there's more of a demand than ever before for students to understand how healthcare within the community interacts with and supports acute care. The Ponderosa Project is a research project funded by Michael Smith Health Research Foundation. The project will be completed in September of 2013. And we are very excited about the outcomes to date. We believe that it will result in students who are much better able to handle the transformational competencies of leadership, such as delegation and advanced decision making. They will have an appreciation for and a competence in gerontological nursing, and they will understand and be able to work competently within a seamless continuum of care. Our students have been used to a model of clinical education that involves close supervision by a faculty member, what I call the mother hen and little chick model of clinical education. Although that kind of support is wonderful, the Canadian government has been discovering is that more than half of nursing graduates are leaving the profession within 5 years of their graduation.
When Barbara came up to me and approached me about the Ponderosa project, there were two limitations that were really striking to me. Number one, the students weren't prepared to work with the aging population, and I feel because of that, there was a lot of negativity that resounded because of it. It's about how I think we were training the students, working with the students. We needed to change that. That needed to be looked at differently. With the Ponderosa project, students enter the clinical area not working in silos of care, but in one large continuum of care. They were able to work on discharge planning with other healthcare professionals, and they were able to go and do home visits to make sure that patients were safe in their home environment and not at risk.
We've had the nursing students come in, and what they've done with me is that they followed me around visiting some of the patients in the building, and then what they've done is they've taken some of our patients who've actually been discharged, and we've actually gone over quite a few of the charts over a period of about 6 months, and we've actually found that, much to our surprise, that a lot of these people have actually done better than we actually hoped. That overall we are basically meeting the demands or the requirements of the program, and we've actually done pretty well.
So for myself, the leadership that was gained was second to none. We got to think ahead, to think of the patient, and not just about the skills that we learned, but the full continuum of care.
This program gave me different ways to care for the patient overall. You take this way of thinking for all different types of patients, not just geriatric, but all ages. It was extremely beneficial, not only for me, but for all the patients.
In the beginning, when we were at Ponderosa, we were working a lot with patients, working with their nursing care and their day-to-day issues. We had a lot of opportunities to attend rounds with the attending physician, the social workers, physiotherapy, all aspects of the healthcare team. Eventually, we got to follow several patients home to just check up on the safety of their home, any resources or adjustments that they might need to make in their home, dealing with the transition, getting back to normal, and hopefully be preventing complications and any difficulties that might end up with them being readmitted to the hospital.
Served the purpose, I mean, is all I can say. Yeah, it taught me to be on my own.
Good.
Independently. I had people there that I could call on if I needed them. I think they looked at my knee because I'd had the dressing removed and it was healed.
Very well. Yeah, no problem. They were very pleasant. There was no issue at all with that. They didn't seem to be overly nervous either.
No, I had met them in Ponderosa, so.
It was at that time she'd broken her ankle.
Look around and
yeah, we showed them around. Showed them. They were demonstrated. Actually, I think they wrote it down. One of them, both of them did, didn't they?
Well, one went down, and the other one came back up.
And then we took them into the bedroom and the bathroom and showed them equipment we have in there.
At the end of the day, we know of the dropout rate that has started to happen for those in the healthcare sector. A plan was set in motion to change clinical work from pure skill-based to a streamlined continuum of care. The students would think more for themselves and rely on healthcare professionals instead of just the clinical instructor. This will help more with exposure to the gerontological population and lower readmission rates to the hospital. In the end, the Ponderosa project lays a more holistic foundation for nursing.